Okay, it's almost 1. Not everybody is here, but give them a few more minutes to sign in. I can hear that dinging. I don't know if that's only on my end. Does anyone else hear that dinging every time someone comes in? No? Okay, it's just on my end then. That's good. I wanted to fix it so it doesn't do that for you guys, but if you can't hear it, that's good. Okay, we're almost there. I am going to pull up the PowerPoint. So which screen can you guys see? Can you see just the images or can you see my notes on the side?
I can only see the images, Leslie.
Okay, okay. And I have to move. So I wonder if that's what's being recorded. I want that to be what's recorded, hopefully. Because that way nobody's face gets, left on the video. So what I'm going to do is everybody in, I think I can't see. The only issue I can see with this is that I'm going to have a trouble seeing the chat, and I really want to see the chat. So I'm not totally sure how I can do that. Oh, I see it. Maybe how I can see the chat. Okay, it's going to take me a second to get to the chat. There's a couple times I'm going to ask you guys to type into the chat. So I want to, and then I want to see if someone has a question, but it's kind of, it goes out of my view. So it's going to take me a little bit to get to it. But it looks like everybody, there's 29. So I think we're still missing a few people, but that's okay, because the beginning isn't anything that can't be kind of figured out on one's own. So I want to welcome everybody back from break. I hope that it was restful. I hope you guys were able to kind of rejuvenate and just have some time to just chill your minds out and not stress too much about all the stuff that's going to be coming this semester, because you have another busy semester. I saw half of you in Kristen's class, so that was fun to see some faces today. And you have been, hopefully it's like a kind of a study or a downtime day. It'll become a study day eventually, but this morning hopefully was kind of a down day for you, or maybe you work or whatever you are able to do. So I wanted to give you guys just a little bit of an overview, like an overview of the syllabus, very quick overview. I definitely want you to go through and read the syllabus, because it's like your contract, sort of. It's like what you're getting into with the class. So I very much encourage you to just read through it. Most of the syllabuses have a lot of similar things. So, I mean, a lot of it is just, you see it in all the classes. But you want to pay attention to obviously the things that pertain to this class. But I just am going to pull out a few of the highlights that I think will matter most to you guys. I wanted to thank you guys for the feedback that I received for radiology. I've thought a lot about how to put that feedback into really constructive use, because that's, the whole point of anything is you try and get better. So I've been really deliberate about a few things. I've thought a lot about it over the break. And so though there were, things potentially out of my control with last semester, I have really strived to post this schedule and this syllabus at its completion. I mean, lightning would have to strike and the gods are going to be messing with me because there is no reason on my end that anything should move. So I really have strived to do this because I think it's very, very important that you guys have stability and you know what to expect or what's coming up, especially when all the stress of patient care starts coming in. So I want to acknowledge that, and I want you to know that I have put a lot of effort into doing that because I hear you. So with that being said, on top of that, I want you to know that the assignments and the quizzes, I'm trying to make things very sort of structured and precise, and you know always where you're going to hand stuff in. I don't want things emailed to me or slid under my door. I want you to always know every week it's the same thing. It's the same place. The dates are correct and it's predictable. And it's not a question of where something should go and when it should be due. I think that is very important. So I've tried really hard to make that, that be that way for this semester. So I know that, I think that it's part of kind of valuing, you guys value that in your education, and I value your education. And so I really want you to know that I thought about that. On top of that, I'm gonna, it flashes at me. Oh, good. Okay, yes. Okay, so on top of that, I'm also going to be really firm with the 25%. I think I might off if you are late with an assignment. I may be possibly the only faculty that doesn't hold that up, and that's not right. I'm not holding up my end of the bargain, and I don't think that you guys think that I value your work if I don't hold you accountable. And I think that's another part of being an adult learner and being in a university with high standards is you're held accountable. So I'm going to be really strict about that. And I just want to say that up front so that everyone heard it come out of my mouth so that you know that that is going to be something I'm focusing on and getting better at. That's like a quality. I have to get better at that. So I'm working on that for myself, but that is going to be something new from last semester that you guys probably aren't going to be as used to. Okay. Okay, so now, so that being said, let's go on to the syllabus. I pulled out a few. Does anyone have any questions so far? No? Okay. I pulled out just a few things from the syllabus. I can't see the PowerPoint unless I look up because a few of your beautiful faces are blocking. So I'm gonna have to look up, sorry. So the highlights for the course, the assignments and assessments for this course, you're gonna have 3 exams within the 15 weeks. And those have already been put into the schedule, and we've talked with other faculty about when their exams are. There should be no reason to change anybody's exams. Someone would have to hold a gun to my head in order for me to change an exam. And so there's 3 of them in the 15 weeks. And then you have 10 quizzes. So basically on weeks that you don't have an exam, you have a quiz except for today, which is week 1, and then week 15, you won't have a quiz because we're gonna review for the final. So you're gonna have a quiz or an exam basically starting next week, every single week until week 15, and then week 15, you won't have one. The quizzes are going to be right in the beginning of class, and they're going to review the material that we did the week before. So it's just a way to keep you guys in it. So there's not these long spans where you're like, we haven't done anything. I don't know what, and you have to study all this material. So it's just kind of a way to keep you guys going and keep you in, actively learning it. And then you're going to complete 2 exams. 2 assignments. These shouldn't be bad. The first one is just kind of, it's just like, it might feel like busy work, but what it's doing is it's really getting you familiar with some of these very common drugs that you're going to see in clinic. You're going to write them down by hand. So you're going to get the generic name, the brand name, some of the actions, like what the indicated use for the drug is. And these are all drugs that you're going to see these drugs, you know, all the time as a clinician. So it's just good to start to get these in your repertoire. And so, and we'll talk more about that assignment in a little bit. And then the second assignment, I'm not even going to bring up because it's not for several weeks that we even have to talk about it. So I'm just going to leave that off. But there are 2 assignments that are kind of like several weeks to finish them and turn them in, and they're 20 points each. Then you have all the readings. So it's usually like 1 to 2 chapters a week. Usually I think it's closer to 1 chapter a week out of the textbook. So you want to, ideally you'd read it, you know, before your lecture so that you have some kind of familiarity with the lecture. And then you'd hear me go over this stuff, and then you'd go over it again on your own time. So that would be ideal if you had already read the chapter before Tuesday, but you know, that doesn't always happen, but that's probably best practices. And then the study guide. So half of you already got the study guides. This is, the other half of you are going to get them. I asked Monica to hand them out to group B tomorrow. So you'll get them tomorrow afternoon. And it's a booklet, and it has all the study guides for all the chapters, and it's front to back. So they're front, you know, both sides. And I don't know if now is the best time for me to talk about how you're going to, I guess I might as well just say it now. So the best way to submit those, when we look at the Moodle page, you'll see that there's a submission area for those pretty much every week. I think there's only 12 submissions, so it's not every week. So it's not on exam weeks and things like that. We can look back at the schedule. But I want those handwritten. I'm not gonna grade them like grade your answer to see that your answer is perfectly correct. That's for you to see, oh, okay, so, you know, if I just pull up something, how are drugs classified is one of the questions. So everything that's in the PowerPoint, everything that's in the chapter, write everything that you can find about how drugs are classified. So it's for you to learn the material, not to have like the perfect answer from me. So I'm not going to go through and grade everybody's that way, but I will post a key from my answers, like, because I've gone through and done one myself. And so I'll post what I wrote, but it's not graded that way. It's graded more like, did you submit it or not? So if you submitted it, A, you're helping yourself because you're learning the material, right? And then B, I don't even know what, oh, B, I just can see that you participated. So it's like extra participation points, basically. So it's 3 points per study guide. And then you just have them all in one place and they don't get lost and whatever. So those are all of the assessments and assignments. Here's the grading. So the quizzes are 10 points each, and then I'm going to drop the lowest. So it's 25% of your points. I worked also really hard. I went back and forth with Tatiana, she's in the library, so many times to get it so it's not weighted weird. So it's just like a point is a point. And I think that's how it ended up in radiology, but it was confusing on your end. So I'm hoping it doesn't look as weird on your end, but I can't guarantee. On my end, it looks great because I spent like a day on it. Sorry, I saw someone was in the chat. And by the way, if you guys chat to each other, I have no problem with that. Oh, I thought I was missing somebody. Okay. Yes. Okay. I see your message. I don't think it'll matter right this second, but I will put you in there right after we're done. The numbers didn't match up to me, so I wondered about that. Okay. Okay, so let me tell you how to submit the study guides. And if somebody has asked a question and I am missing it, feel free to unmute and just shout it out. Okay, so these are the point systems. That's the percentage. And then, and I already mentioned, and then right after I do this, I'll tell you how to submit the study guides. And then this is just another reminder so that you guys know that I'm committed. I'm committed too. So anything that's submitted late without prior arrangements with me or an emergency, like you're in the hospital, you're got into a car accident, you're in bed with a fever, but anything outside of that, truly true. Before you ask me, ask yourself, could this have been avoided? Ask yourself as an adult learner, could I have avoided this? And you probably will answer it for yourself. And then you'll know whether 25% should be taken off. But I will always accept the late work. I will always give you some points, but there'll be that deduction. So, okay, so the way to submit. So this is also important for the assignment because the assignment 1 also needs to be handwritten and there'll be several pages. So the best way is if you have an iPhone, I can show you this. If you don't have an iPhone, it may still be this way. But if you go into your apps or whatever, and you go into the notes, that one, the note. And then when you press it, let me make sure I'm going to do this right. Yeah, okay. When you go into notes, down at the bottom, there's that camera. Push camera, and this little pop-up will come up, and it'll ask you if you want to scan a document. And then you press scan, and then the camera will come up. It's going to be weird because it's going to want to scan my face. But do you see how, oh, that's lovely. But you see how it's like a little yellow thing popped up and it's looking for the document and then it takes the picture and then you can adjust the corners to get just so, you can crop it in just so. And then you can say keep scan and then you can go next and you can add another document and another document. And you can do that. And then when you have however many pages, say it's 5 pages for the study guide, or say it's 10 pages for your assignment, you can submit that into Moodle as just one upload. So instead of using your regular camera and just taking 5 different pictures and uploading like 5 different JPEGs, which may or may not work out, just go into notes, and then the little camera at the bottom, and then scan document, and then you can title it too. Once you have your documents, you can just push the top and it lets you retitle it. It'll say something like scan 1 or something like that, but you can title it to assignment 1 or study guide notes week 3 or whatever it is. Now, anyone who doesn't have an iPhone, does anyone not have notes as an app? Does everyone have it?
I think that Notes is just an iPhone.
Is it?
I don't have it.
You don't have it? So alternatively, you can, if you have like, I still think that you can submit a JPEG, but I'll do a trial run. The study notes aren't going to be due until next Tuesday. So after I'll take a picture and I'll do a trial run, like a regular JPEG, and I'll see if it uploads to Moodle. Alternatively, you can take a regular camera and then you can send the images to, how did you guys send in pictures to Katie Bell's class?
I just emailed them to myself and then would download them to my computer and scan them or upload them to Moodle.
Do that too. That's perfect. So how was that?
I had an application that I just took the pictures on my iPhone and then I just converted the picture to JPEG.
Perfect. Any way you guys can figure out to do it, do it. I like the scan thing because Holly taught me that last year. And so now I use it all the time instead of printing off documents and stuff, but, or scanning documents that way. But any way that you guys found it successful last year or last semester with Katie, because I know you guys had to send in pictures, do that with this.
With the new iPhones too, they save on like this certain picture. It's like HIC or HEIC or something, and those don't go on to Doodle correctly. So if you
Oh.
go onto your settings on your phone, you can change it to where your iPhone then takes pictures in JPEG form, and then you can just send them directly to Moodle and not have to like do all these steps too. I
That's
learned
good
that.
to know. So that's just with new iPhones?
Well, I mean, I had like a XR before that, and then I had like a 10 before that, and I think they all did it. So like any of the recent ones pretty much. But
Okay. I wonder if it wouldn't do that if you do have an iPhone, if you just did the notes and scanned them in. I mean, however, I don't want to make it more confusing. If you guys have done it a certain way and it worked last semester, just keep doing that. Okay, so next, so I'm just going to pull up the course schedule here so we can look at it together. You guys actually are going to be able to see it because can you guys see it, or do you still see the course schedule Zoom link PowerPoint?
We still see the Zoom link.
Can you see this now?
Yeah.
So here's the schedule. Everything that's due is going to be due Tuesday by 1. You can turn anything in early, but you have to have it in by class time. So I'm just keeping everything at that same time, so there's no confusion about everything. It's just all due right before class. And then I just tried to color code it so you can see the differences on the schedule. So all quizzes are in purple, and then what the quiz is over. Study guides are like brown or whatever that is. And then this is the topic. This is the chapter that should ideally be read by the day that we're lecturing. And then this is the topic that will be covered that day. So like today we're doing general principles of pharmacology. Next week we're going to finish up anything we didn't get to today and go on to the autonomic nervous system. So this is what's being covered in that class, and this is the corresponding chapter. Exams in red, this is what's going to be covered on the first exam. It's chapters 1 through 3 and chapter 16. Chapter 2 is going to be week 9, and this is what it is over. Spring break. And so it's just basically the same. You can see the assignments are in green. So assignment 2 is not going to be due until week 14, and assignment 1 is going to be due week 5. And you can turn it in any time before that if you want to. And then the other thing that this class has historically done, which everyone really loved, but we're going to not be able to do it as much this semester, is have guest speakers. The first 2, I think they're more, they teach in pharmacology in the upper class levels. So their schedule seemed to be a little bit more flexible. So John Berger is going to come in and talk about cardiovascular drugs. And then Jeff Fortner is going to talk about the GI system and drugs associated with that. And then these last 3, Bridget and Brandon have guest lectured. Jessica has not. I actually think all 3 of them are going to end up being a recorded lecture, which I'm bummed about because that's just not as fun. But they have like almost what seems like their OSCEs on Tuesday. And so these faculty just simply aren't as available. So Bridget said for sure hers would have to be recorded, and Brandon was going to try and fit us in, but I don't know if it's going to work. And then Jessica was going to do hers live, but she was going to do it after your 3rd exam. And I started thinking, yeah, I don't know that that's going to work out. I don't know that after you guys take an exam, anybody's going to want to hear anybody lecture on anything. Plus, her lecture would be content that would be on your exam. So it really doesn't make sense. So hers is more than likely going to be a recorded lecture as well. And she talks on pain management, which I think will be great, but it's just, I don't think it's going to work for live. So that'll be a couple recorded lectures, but we do get 2 live new faces. So it's always kind of fun to have a new face. Get sick of listening to me drone on, so then you can hear somebody else. So that's the schedule. Anybody have any questions on that? Nope, okay. Good deal. I'm gonna X out of there. The Zoom link is always going to be the same. It's at the top of the Moodle page, but you can get it, you know, however if you save it somewhere else. But it's always going to be at the top of the Moodle page. And then more than likely, there's going to be different Zoom links for the weeks that we have exams, because I'll probably find a faculty to proctor with, like we did last semester. And so then we'll have 2 different Zoom links. So exam weeks will be a little bit different.
Leslie,
Yeah.
I don't know if I missed this, but are our quizzes on Moodle or are they on ExamSoft?
Thank you. I did not say. So quizzes are going to be on Moodle, and it's on like a lockdown browser, but it's I'm not going to like scan the room or worry about if you have notes out even. I don't even care. I mean, it's going to be timed, and you can't really like use your computer, I don't think. Yeah, it's going to be timed. So that's, you know, that kind of puts you in a place where if you don't know the material, then it takes you longer to look stuff up anyway. So I don't really care if you have notes out and you have a book out. You can try and use it as a resource, but that only gets people so far anyways. But so yeah, they're going to be on Moodle though. And they're mostly multiple choice, but even the exams can have like a short answer or a different format. Predominantly all the exams will be multiple choice, but not all questions are going to be multiple choice. Some will be like fill-ins or short answers. Okay. The last thing I did want to do was show you guys just quickly the Moodle page. I think I have to draw this up here. Can you see the Moodle page? So just so you can see, for example, for next week, study notes 1 and 2. So you won't, those of you who don't have this, you won't be able to tell, but at the top, it says like oral medicine notes from Principles of Pharmacology. And then if you flip like 3 pages down, it says, it's not really bolded or separated in a good way where it's like, oh, you kind of have to just read the top of the page. It says oral medicine study notes, endocrine, thyroid, and diabetes. Oh no, sorry, I went too far ahead. This is what I meant, autonomic nervous system. So next week, Principles of Pharmacology and autonomic nervous system study notes are the ones that you would take pictures of and submit. So that's study notes 1 and 2 is the Principles of Pharmacology and the autonomic nervous system. It pretty much follows whatever the week that we're lecturing on. So that's the same. So this little hand with the paper, so if we scroll down to week 3, we have study notes 3. If we scroll down to week 4, that's an exam, so no study notes. We scroll down to week 5, down at the very bottom, you have the study note submission and you have your assignment submission. And then you can see also like at the top, we have cardiovascular, we have the quizzes. So usually the first thing at the top of the Moodle page will be the quiz, then there'll be your resources, and then at the bottom, there'll be study guide submission point and if there's an assignment. That sound good? So that's.
Leslie, I have a quick question.
Yeah.
On our Moodle screen, we can't see past week 2 right now. When will you like release the next week so that if we happen to get done with the study notes sooner, we can submit them when we're done?
Submit it. So my goal is on Friday. Well, let's see. So I've already opened 2, right? So my goal is to keep an extra week ahead for those of you that kind of like to see. So my goal is to open week 3 this Friday. So what I'm going to try and do is do like a really short, like 3-minute, 5-minute at the most, little video that just reminds you of what to do for the next week, and then release that email and at the same time open up the next week. So always on Friday. So this Friday I'll open up week 3. So I might open up more, but at the same time I hate getting too far in advance just in case I change something in a PowerPoint, because I'm posting, I don't know if you guys noticed, but I'm posting a PDF of the PowerPoint, not the PowerPoint. And so it like locks it in like concrete. I can't go in and edit the PDF. So I like to give myself, just so I'm not changing stuff, so that just like Kristen said this morning, she doesn't like to open stuff up until she has it all done, because then it just looks like we're just like, I don't know what we're doing. And so so I'll probably just be like maybe a couple weeks ahead, but I probably won't just open up the whole semester, just because it takes me time to get to everything, all my checks and balances and that sort of thing. Does that sound okay?
Yeah, that sounds great. Thank you.
Mm-hmm. Okay. Okay. So let's take a little stretch. It's already been 30 minutes. Let's just take a little 5-minute, get your eyes away from the screen, stretch, go to the bathroom, and then we'll come back and start on the principles of pharmacology, okay? I'm just gonna see a chat there.
Hey Leslie, can I ask you a clarifying question?
Yes.
So for the quizzes, like for quiz 1, it says it's over syllabus, and then chapter 1, that's the chapter 1 book notes, right?
Well, I'll answer that to everybody, because that's a good
Okay.
question. But it is like the chapter. But so I just can't ever say that. I don't want to get myself in trouble, whereas if something isn't verbatim off of the PowerPoint or verbatim off of a study note, that you guys are like, that wasn't what, you didn't tell us we needed to know that. Basically, the whole chapter is what you guys, are responsible to read and understand. I'm never going to try and be tricky and find something that we never talked about. You know what I mean? But when I mean chapter 1, I do mean like the book chapter 1. But yeah, so it's like kind of half of what you're saying and have not, because it's like if we never talked about it and it's just some obscure fact in the book, that's not going to be fair game. But things could be embellished or have more to it in the book. Does that make sense?
Yeah, so it's like the book topics, but if we talked about something in lecture, we should know that as well, is what you're saying.
Yeah, and I'll tell everyone this when we get back. But I recommend, this is going to be recorded, which I should pause it. But this is, Sorry. So I kind of think it's not a bad idea to read the chapter, go over the PowerPoint, and then you'll have, you'll listen to the lecture, and we'll do our interactive stuff during this class time, but then give yourself like over the weekend or Friday or whatever you have, if you have like maybe not Friday, but maybe like Saturday, maybe kind of listen to the recorded lecture again, or at least skip through it. And because there's probably going to be things that are said that people just don't hear the first time, you know what I mean? So sometimes that's helpful, because I'm not going to post recorded lectures. I'm just going to post these Zoom things. Okay. I have lost my power. Can you guys see the PowerPoint? Okay. So I was just talking with who was I talking with? Brianne. I was like, who was that? Oh my gosh, you guys. So she was asking about the quiz and what it's over. So week one, it might look a little bit confusing, but the first 5 questions of the quiz are kind of like quasi freebie, quasi what did we talk about the syllabus? What are the important things to remember about how this class functions? So it's not content on pharmacology. And then the last 5 questions would be like the very beginning of what we're going to talk about today. It's just chapter 1 content, but early chapter 1, because I didn't know how far I would get into. So to be safe, be prepared, because you're going to get another quiz the following week that's more comprehensive on this talk and autonomic nervous system. So it's good just to be prepared anyways. But the quiz, the first quiz that you guys are going to take next week is a lighter one. It's an easier one, just to kind of get your feet wet. Okay. So we're going to talk, I have several areas here where I want to have you guys type into the chat. But I kind of want to make sure that, here are the objectives. You guys can read through these on your own. I always feel like you get enough being read too. So here are the objectives for this lecture. There's 2 pages there. So why pharmacology? So when you guys see these green, type into the chat box, think about the answer and then wait until you hear me say go to put the answer in, because sometimes if people see the same answer, they are not as likely to answer, and I want everyone to feel like they can give their answer. So it's kind of like ready, set, go kind of thing. So why is pharmacology important to a dental hygienist? Why do we even care about this subject very much? We're not dentists, we're not prescribing narcotics and things like that, so why do we care so much? So think about that for a second, and then go. Yep, oral implications, how it affects treatment. We need to know the medication's effects. We need to know the dental implications. Good. Yep, you guys have already thought about this. We work with pharmacists every day and we give out some prescriptions as well. We do. Oregon was, I didn't look this up yet, but Oregon was the first state, and maybe still the only state, where hygienists can prescribe some medications, which is amazing, really. I know Colorado and California are very progressive. Maine and Vermont as well, but I don't know if any of those places allow for the hygienist to prescribe medication. I'm gonna look that up actually, because that would be good to know if that has changed in the last couple of years. So good, yeah, effects on local anesthetic, just how drugs interact. So that's really good. So there's lots of reasons why we have to know about all that. Just like what you guys said, it's important to know the patient's medications and how they impact their dental hygiene care. And then we want to understand how the medications could interact, or if there could be a possible medical emergency. If they're taking something that is, some kind of a really, crazy drug that interacts with stuff, we want to make sure that we know if something medical emergency could happen. And medications can affect the oral cavity, so they can have long, kind of chronic effects on the oral cavity, increasing their risk to disease, or they could have an effect with some kind of treatment. Our treatment care or our treatment outcome could be affected negatively if potentially. So all those reasons, we want to be aware of dosage. We want to know what like a normal dosage is, and we want to know how often the patients are taking it. If they took their medication, they might be like, yeah, I was prescribed blood pressure medication, but I don't need to take it, or I didn't take it. So we want to know those things if they took their regularly scheduled medications. And bleeding is a big one too, because we do stuff that causes bleeding. So we want to know if bleeding is going to be an issue with our patient. Everything's like overlaid, you guys, on my screen. So I'm like trying to find the buttons to advance. Okay, so when we think about our process of care, we need to be familiar with the drugs that we use every day. There's certain ones that we become so complacent with, sort of, in some ways, because we see them all the time, and it's even hard to think about some of them as like a drug that could actually have negative effects. So we want to be familiar with the drugs that we use and prescribe on a daily basis. We need to know the drug's interaction with other drugs, medical contraindications. The patient has some kind of an illness or a chronic disease. Fluoride could that could be something that's contraindicated, that they couldn't handle or they couldn't process or metabolize. So we want to know all those things. And then we want to know the appropriate dose for the patient, for their age, for their weight, for their disease status, if they're immunocompromised or if they have some kind of another heart disease, all these things. So we just really want to be familiar with the basics that we use: local anesthetic, fluoride, chemotherapeutics, that sort of thing. Okay, so there is a lot of terminology, and I'm going to try, I'm going to move this. There is a lot of terminology, and I'm going to try to repeat the terminology several times so that you start to hear it, and because some of them kind of overlay over each other and start to sound familiar or start to sound the same. So pharmacology is basically the study of drugs, if you just say it super simply, but it's the biomedical study of how a drug affects the body. So if we were to reduce that into a very simple concept, in one sentence, what do drugs do to the body? If we're to kind of like distill this down to a very simple concept of what's happening to our bodies when we take a pill, let you guys kind of mull that over for a minute. You don't have to type it into the chat, but the answer to that would be drugs basically alter a normal process in our body by doing one of two things. It either will stimulate a cell function, or it'll depress a cell function. So it's gonna alter the normal process some way, either by stimulating or depressing a cell function or the function of a cell. So that's what we're kind of studying, and it's broken up into, oh, nope, we're talking about regulatory agencies. So I was going to jump way ahead. So who's regulating the drugs? So we know that we take the pill and all this stuff happens, and we want to know about why it happens, but who's out there regulating and making sure that we take the right dose and that something is safe? So there's a couple different agencies to know about. Mm-hmm. I'm not sure I knew what that last one meant. Okay, so there's a couple to know. So the first one is the FDA. So the FDA is going to regulate several things. They're going to determine a drug's safety and its efficacy. If they're going to regulate physical standards and the chemical standards of the drug. And then they're going to kind of watch over the quality control of manufacturing of the drug. They're going to oversee both prescription and over the counter. So they regulate both. And then they also have a lot to say about advertising and about labeling. So, you know, when you guys are listening to those hysterical ads about like every drug nowadays, when you have a commercial that talks about a drug and then it talks about all the wonderful things. And then at the end, it's like the list of horrific things that the drug, you know, the side effects. So that is part of the FDA regulation. And even further than that, they require that not only are like the serious side effects, but also some mild side effects are also mentioned in the ad. So it's kind of like this swath of, you know, death to like, you know, itchy, you know, whatever, itchy skin or something. So the FDA regulates all of that. And if you click on this link here, I'm not going to do it. Oh, you might not be able to in your PDF. Maybe I'll post this link separate. Or you can always look at it and like copy and maybe paste it into your browser. But basically it's just a resource. It's loaded with information, loaded, you go click on this website and there's all this safety, things that are recalled, things that are being tested. I mean, it's just a plethora of information at this fda.gov/drug safety. So that's just a really interesting resource. So it can take between 2 and 17 years to get FDA approval of a drug. And approval basically means that the data on the drug's effects, how the drug affects the bodies, they have been reviewed by a group called the Center of Drug Evaluation and Research. That is CDER, the Center of Drug Evaluation and Research. And they've collected all this data on the safety of a drug. And then the drug is determined that whatever benefits they have found from this drug, all of those benefits outweigh any possible negative side effects. So that's what it takes for a drug to get approved. I saw a little. Oh, nice. Okay. So the next one is the Federal Trade Commission, and basically they protect consumers against unfair practices in the marketplace. So it's not so much on regulating like the quality and the for your health, that sort of thing. It's more like making sure that, you know, one company doesn't always have a monopoly on one thing forever, so that the, you know, prices are more fair and that sort of thing. They benefit consumers by keeping prices low and quality high. They protect against false advertising of food, over the counter, and cosmetics, although frankly, I don't know, I still think things are falsely advertised. But that's, the Federal Trade Commission is important, but we don't focus on them quite as much as FDA. And then the last one to just make note of is the Drug Enforcement Agency. They oversee or they regulate manufacturing and distribution of like controlled substances. So, you know, obviously narcotics, stimulants, sedatives. And then their mission is to enforce the controlled substance laws. So there's all these laws about who can write prescriptions, and you know, then they will keep track of how often certain physicians or dentists write prescriptions, and all these things. That's why you have to have a DEA number, so that physicians and whoever can write for narcotics and sedatives, they don't abuse that right. And okay, so my throat is already getting dry. So now we'll talk a little bit about drug names. If you guys would, I tried to do this. Let's see. Oh, I think I can just think about it. We came back at 135 and it's 150. I just want to try and give us like a mental break every 25-ish minutes, even if it's just enough to get up and walk out of the room and shake and come back. So I have a timer set, but I didn't press go. So if anybody, if I'm going on too long and anybody just needs a break, just chime in and say, can we have a quick break? If you just need to get up and just go outside or go to the bathroom, or, I want to try and filter in lots of moments for that, because I know this can get to be a bit much. Okay, so drug names and properties. So each drug is given 3 names. So the chemical name is the first name. The chemical name is its unique molecular structure. And as you can imagine, it's going to be a very long chemistry-like name. So just for fun, can anybody guess what this first N-acetyl-para-aminophenol, what might that be if you think of its brand name or its generic name? I would take either one. So 1, 2, 3, go. Tylenol. Yep. So Tylenol. Acetaminophen is going to be its generic, or Tylenol. So that's what that is, N-acetyl-para-aminophenol. Saying these names this semester is going to be a trick. So that's the chemical name. So it's not used regularly. Nobody goes around saying, I have a headache. Does anybody have some N-acetyl-para-aminophenol? They say they've come up with other names. And so the brand name or the trade name is the proprietary name. And that is the company or the manufacturer or the lab or whatever who first discovered the drug, and they patent it. And so when they patent it, it's theirs, and they come up with a brand or a trade name. And so this lasts, they have it for a certain designated amount of time, 17 years, and then their drug patent is up, and then comes in the third name, which is the generic name. And so the generic name allows Tylenol, acetaminophen, for say, like Safeway or Walgreens, for them to produce their own acetaminophen, Walgreens style, or whatever Target. So that's the generic name. And that contains the same therapeutic active ingredients, the same everything. Sometimes the inactive ingredients can be a little bit different, but the generic holds the same therapeutic, all of that effect. And it's just that the price is less. So the generic allows for the price to come down and for there to be competition. And so people are not price gouged. So about 17 years before that happens with a drug.
So Leslie,
Yeah.
sorry. So Tylenol would be the generic name or the brand name?
Tylenol is the brand name.
And then generic would be acetaminophen.
And I have another slide that will break it down a little bit better. I know I kind of said it and you don't get to see it visually. So the next slide will show it a little bit better. But yeah, that's for Tylenol. Tylenol is the brand name or the trade name, and acetaminophen is the generic. Let me flip it to that. Oh, I have one more slide before I get to that one that I was talking about. So then the other thing that is important for you guys to know, besides the 3 names, of course, you're not going to have to memorize chemical names of drugs, but you just want to be aware of that they're there and they're out there. But you're not going to have to know them or memorize them at all. That would be horrific.
Really quick, I already put this in the chat, but I also just looked up the PDF PowerPoint on Moodle, and for Tylenol, the drug that's listed on the PowerPoint is different than what you have in this one.
It's this right here is different.
Yeah, the N-acetyl-para-aminophenol is different.
It's because in your textbook, it says what's in the PowerPoint that you guys have. That's what's in the textbook. But then I noticed that some of the course material had this. And so then I was like, oh my gosh, what's going on? And I looked it up and it's hard to find, but this is what's on my PowerPoint slide is what is more common. So the textbook, I'm not saying the textbook is wrong, but it doesn't appear that the way they write it chemically is as common as this here on this PowerPoint. You are not going to be tested on it, so don't even worry about it. That you're not going to be asked that question. But you are right, they're different. And it's because, see, I've made it a PDF and then it locked it into stone. And so that was after I saw that. But don't,
Okay.
there's not the chemical, you will be asked about a chemical name in the form of what is it? Like it's the molecular structure. But you're not going to be asked about like memorizing them or anything. So when it comes to the classifications of drugs, this can get a little bit confusing because sometimes the classifications can be, you can think about things like drug categories or schedules, different kinds of controlled substances. But what we're talking about here is the intended use of a drug. So when we say drug classification, what is it? What's the predominant reason someone would take that pill? So for example, it controls diabetes, or it's an anti-diabetic, or if you take a Tylenol, it's an analgesic, or if you use Abreva, it's a topical antiviral cream. You know, so there are these main reasons that you'll use the drug. So other names that you might see are pharmacological category or therapeutic effect. So it's basically just think about it like, why did you take this drug? That's what the drug class. And lidocaine is a local anesthetic. So it's like that. So here's the slide that shows that it kind of breaks it down. So, so the brand name, xylocaine or octocane. The generic is lidocaine, one of the most common ones to use for local anesthetic. Chemical name is this big old thing here. And then its class is it's a local anesthetic. Same thing here. Generic is acetaminophen. Chemical name, it's an analgesic, and the brand is Tylenol. So when I show you guys, I don't know if this is coming up next. Not quite. In a couple slides, I'll talk about the assignment 1, and I'll show you what you actually have to look up and put in there. And I don't believe chemical name is one of them. I actually had a hard time finding some of the chemical names of some of the drugs, so it's not always, I think certain books maybe put it in and certain books don't. But that is 2 examples there. So labeling, when this is for an over-the-counter, but labeling also when you get a prescription medication and you have a whole packet, all that information, like if you have, you know, an antibiotic or something like that, you have like a whole packet. So that's going to be it's going to have the same kind of regulated information that should always be there. But for this, which would be like an over-the-counter, you're always going to see the active ingredient. You're going to see the dosage in each capsule. You're going to see the purpose of the medication, the uses. What does someone use this typically for? Any warnings? Why you wouldn't want to use this with something else, or don't take it when you're doing this, or don't take it with another medication, or whatever kind of do not use or warning. And then the general directions, you know, do I pop 10 pills, or no, you take 2 every 4 to 6 hours, you know, so then the directions of how to take it. Other information that's important, inactive ingredients in case somebody like has an allergy or something, and then questions and comments, and usually there's like a phone number or something so that you know how to reach somebody. So this is all kind of standardized information that has to be on a label. Drug references, here are some here, some more here. There's also apps. So on page 3 of your textbook, there's a long list of resources and references, drug references. But this one here, Epicrats, they have an app. I think Lexicon might have an app that you can actually put on your phone. So when you go out into private practice, and if you don't work for an office that has paid for a subscription in their computer system, then you could always put an app on your phone, and then you would have quick access to an online reference. But these are just a few websites as well. But like I said, the page 3 had several others, but these are just kind of more popular. PDR is the physician's drug reference. There's Mosby's dental drug reference. Okay, so I'm going to talk about this assignment, and then we'll take a little bit longer break, like maybe 10-minute break. And then we'll go into the heavier content. Okay, so the first assignment, this is not due till week 5. Some of you might get really antsy and just want to get it done when the semester's early. This would probably take you like a good couple, maybe hours of just writing. So I'm going to push this so I can pull this instruction up. You guys see that? Okay, so it's due February 9th, 1 o'clock, handwritten, 2 resources. And the thing that's a little bit different is I have about maybe 9 books, drug reference books in my office. And we used to rotate them, and people would hand in this assignment staggered. But I'm just having it due for everyone the same time, and you can use 2 online sources. It used to be one had to be the book, and then the other one could be an online resource. But you can use 2 online resources, or if you'd like, I have these books. I only have so many, so I can't, you guys would have to take turns and share them. But if you want a book just to see what it's like to fill one out old school style, then feel free. I have several different versions. So I have them in my office. So I would lend them out if you wanted, but you can use just the online resources too. So when you're filling it out, so I'm going to scroll down to the table. So when you're filling this out, say if this was Tylenol, you're going to put the generic name, you're going to put acetaminophen, brand name 1 only. So sometimes there is more than 1 brand name. And so you can, when you're looking it up online, if there's 2 brand names, just pick the first one. And then pharmacology, action, category, or class, whatever the use of that drug is for, write down your first reference. And then when you go to the second one, if it's at all different or it mentions something else, write that in a different color. So if it's totally exactly the same, the 2 references are like mirror images, you can just write in 1 color. But if your second reference adds something to it that's different, then write it in a different color. The same goes for uses, adverse effects, contraindications, everything. If it's verbatim, your second resource is the same, but if there's anything different, write it in a different color. Does that make sense? And you're gonna have to just cut and paste and elongate this, because this is only for 4 and it's the top 20. So you're gonna have to just, select it all and then just copy and paste until you get 20 spaces. And then here's the rubric. It is due on the 9th. And then the step 2 is just to attach a resource page of your two references in APA style. So it's obviously just going to have, and you could actually put this all on 1 page. Because you're only going to have 2 references, so that probably will take up, X amount of paper. And this you can type. You don't have to handwrite this, but you put your references, and then you can do up to a full page or less. answering these questions. So you're going to attach that to this. And let me pull up the example.
Excuse me, Leslie, I have a question.
Yeah.
So do you have a list of the drugs? Because it says top 20.
Yes, let me show you. Actually, this is the list, but there's another list. Hold on. So in the general section of the Moodle course up at the top, I'm just going to pull this up here so you can see. So we have the syllabus, the course schedule, course objectives, assignment 1, which is the document that we just looked at together. This is the top 20 drug list. So here's the top 20 drug list. And then here, where is that? There was an example. Where did I put the example? Hold on.
Leslie, is it
Leslie, I see it on my Moodle.
Yeah.
It's there on our Moodle. We can see it,
It
the
is?
example. Yeah.
You can see the example?
Uh-huh.
Did I look at it and just not see it?
It's right on the top 20 drug list.
I was like looking at it, but not really looking at it. I see it. It's assignment 1 example. So let me, I'll open this up for you guys, for those of you who haven't. So here's an example, and that's, oh, for heaven's sakes. And thank you. So that's in Moodle, right at the top, and it just shows how, how roughly it should look for each one. Now, the top 20 drugs that I picked are actually the top prescribed drugs of 2019. And the reason I did that is because I thought 2020 has been such a crazy year. The drugs that they prescribed this year are probably skewed a little bit. Plus, I don't know if the data is out that fast. So these drugs that you guys will be using are actually the top prescribed of 2019. But what's that?
Did you happen to change that? Because I have a different list. I downloaded it over the weekend and already completed. Do I have to completely redo my assignments?
I don't think you should have a different one.
Like mine, the first one is lisinopril, and then the
That's what I have as well.
Yeah.
The first one is lisinopril?
No, the first one is, the first one is the lisinopril, and then it's the levo, and then the third one is the atorvastatin. I don't know how to say it.
I know.
Caitlin, maybe it's just jumbled up, but it's the same drugs.
It could be. Go through, well, what I'll have you do is go through and cross-reference it. Just put like a little green check mark for yours. Put a little green, has anyone else done it besides Trey and Caitlin? No.
Like the last medication on there, the Mont, that one's not on there. The singular ibuprofen's not on my list.
So I will say, because I've been working in all different areas of this course, that it is possible that, where did you get your list from?
Oh, I think I just realized the list that
These
you
are
have on
2020.
Moodle is from 2019, and then the list on the PowerPoint is from 2020. So you're good, Caitlin. She just showed us the 2020 on her PowerPoint, but the one she sent on Moodle is the right one.
The one on Moodle is even different now. I downloaded it when you first uploaded it, Leslie, like on Friday.
I just want to make sure that my PowerPoint and my Moodle match, because that's what so if you did it before class opened and something was there, it might be different.
Okay.
I mean, the class didn't technically open till yesterday, so it
Oh.
could be different. But I just want to make sure that so the one in Moodle, so
The
Lipitor,
one in Moodle and the one in your PowerPoint match.
they do match. Okay.
The one that I downloaded before class, I guess, was technically open, does not match.
Mm-hmm. Then what you can do, I guarantee you probably most of them are still the same, because what I was going to say before that is that of these drugs, because I looked back several years and I pulled a list from a study from 2017 or something like that. And lots of these drugs are the same. They're just really common drugs. And so there might be, they kind of go like this, you know, like 1 year, one will be prescribed more and the next year something. So probably at least I would say 85%, if not more, of what you did, Caitlin, is probably going to be fine. So what you just have to do is just find the ones on this list that you didn't do and just do those. And it's okay if they're out of order. Like if just locate them and then just do them.
Okay, that sounds good.
The same for you, Trey. And then you can just, I don't know.
I'll attach the list that I have too, so then you can see.
Mhm. Yeah, that sounds perfect. Okay. Phew. Okay, so we're gonna talk about administration, but let's take a break. So let's come back at 2:20, okay? I'll start recording again. And I did just quickly want to show you two more or one more thing, or say two things, or I don't know. But this is at the top part of Moodle, right before the Zoom, there is a link to this Google Doc. And I don't know if anybody's clicked on it, but it's just, I want it to kind of be alive. That announcement thing that I would make announcements or email them out. But I think, if it's something that is really important, I'll email it out and then I'll also put it on this Google Doc. But this is also a place for you guys to ask clarifying questions or just put questions about this week. Like, I didn't really understand when you were talking about whatever. And then I'll always answer in red so that you just know that the answer came from me. But other people, you guys can use it as kind of a back and forth thing, although that might add some confusion, but I'll answer any questions in red. So if it's week 1 content, if it's about something that we talked about today that someone has a question, put it under here, and this, the document will just grow theoretically if people have questions. So it's just a Google Doc. It's under the general section in Moodle, and you guys can just use that as kind of questions and stuff. So let me get back to the PowerPoint, and we will talk about drug administration. I'm probably not going to get another break in because we only go to 250, right? We go to 250. So I'm probably just going to barrel through for the next 35 minutes and just see how far we get, and whatever we don't cover, we'll finish up next week. Okay, so there's 3 main ways that drugs get into the body, and it's enteral, parenteral, and topical. And so we're going to break that down. So this is how the drug gets into our system, the very rudimentary first step. And so when we talk about enteral, we're talking about anything that gets into the body through the GI tract. Your GI tract starts with your mouth because saliva starts to break down food and everything like that. So that's the opening really. And then the rectal administration, so like a suppository or something like that, that'd be the other end. So obviously you can't get stuff into the middle part very well. So your 2 openings are the enteral. So when we think of oral, we think of just popping a pill, swallowing a pill, and taking it by mouth. Sublingual, you guys can imagine that's pretty self-explanatory now that you have some dental terminology. Under the tongue, to dissolve under the tongue. Buccal would be to dissolve in the cheek, basically. So between the cheek and the buccal mucosa and the tongue. And then rectal or PR would be like a suppository or something like that. That is oftentimes used if somebody is, their stomach is so irritated, they can't keep anything down. And for whatever reason, the drug isn't administered IV. I mean, there's other ways to administer it besides rectally, but there are some instances where that's the best way to get the medication in to soothe like the stomach and to soothe the vagus nerve and things like that. It's also very common with children or infants. Obviously, they can't swallow anything. And IV might be like, maybe it's a too potent of a way or something, and they need like, you know, I'm just kind of guessing. But I'm trying to think of why they would choose that over like an IV, or like trying to get an IV on a kid. I mean, you couldn't necessarily do that because they're so little, although they do have ways in neonates and stuff, but prenatal. But or geriatric. So that those are some ways that they would use that route of administration. And then parenteral administration basically has to do with a needle. So this is delivering a drug via the needle into the skin. And there's specific ways that they do this. We'll talk about 5 different ways here. And the first one is intravenous. So we think of this IV drug, you know, going right into the vein. That's kind of one of the most common ones we think about. Then we can think about intramuscular or IM. That's going down through the connect the tissue and the connective tissue down into the muscle. The muscle has lots and lots of capillaries, so drug absorption usually happens pretty fast in the muscle. So that's why they use big muscles for drug administration. Then subcutaneous or sub-Q, that is under the epidermis and into the connective tissue. Then there's intradermal, which is just under the epidermis into the dermis layer, and that's just barely under the skin. And then the last one is intrathecal, and that one, you guys might want, I didn't look this up beforehand, I meant to, but you can think of this one most commonly when a woman is like giving birth, she'll get what they call a spinal. So they put the needle right into the cerebral spinal fluid and administer the anesthetic so that you are numb from about, you know, wherever the needle is and wherever they started that drug, you're numb from there down. And I don't know if they give any other drugs besides anesthesia. I've had that before, and woo, that was an experience, but you guys might want to look that up and see if you can, just for interest sake, if you see any other drugs that are ever delivered that way. I kind of doubt it. So if we look at the next slide, it shows.
Leslie, will you say that heading again, the word? I can't remember how to pronounce it.
Intrathecal?
No, the administration.
Oh, parenteral?
Parenteral. Okay, thanks.
Mm-hmm. Parenteral administration and enteral administration. And I could be pronouncing things wrong at any given moment. I really am trying to get their pronunciation correct. But if you guys happen to have heard something and you know for a fact I'm saying it wrong, please don't hesitate to correct me. Okay, so here's a slide that shows the different angulations. So when you think about when you're getting your vaccine, they kind of come right at you, you know, and it's like 90 degrees of wherever they're putting the medication into the muscle. Or actually, I don't know if that's how they do vaccines. I don't know if Trey, did they go into your muscle for the vaccine? I was just thinking, like, do they go 90 degrees for vaccine? I don't know. Subcutaneous.
They did my vaccines at 90.
Did they do yours at 9? Yeah. If they're trying to get into the muscle, it's 90 degrees. Subcutaneous is going to be 45 degrees, and that's getting into the connective tissue. Getting into a vein or intravenous is going to be at about 45-degree angle. And then intradermal, so that's when they do that for like allergy testing or TB testing, and they're just very little angle at about 10 or 15 degrees. So I am hoping, I don't like, part of me just doesn't even want to do this because I feel like I'm just going to waste time, but I'm going to try it just to see. I might never do this again the rest of the semester. I was going to put you guys into random breakout rooms and have you think or look up a drug for your given administrative route. And I'm counting on two things. One, that you'll take a picture of this slide so that when you're in your breakout room, because you won't be able to see my shared screen, you'll know whether you're looking up an intravenous drug or an intramuscular drug. So if anybody can, if you guys can take a picture of this slide. And then two, I'm counting on that you'll actually be able to know what room you'll see the number. So when you get into your breakout room, you'll see if it's breakout room 1 or you'll see that it's breakout room 2. Does anybody know ahead of time that if this will absolutely not work from past experience?
We'll know what breakout
know.
we're in. We'll know.
Okay.
It'll say the number.
It'll say the number. Okay. Yeah. So I'm going to, I couldn't do this like, I couldn't do this ahead of time because I have the same Zoom for all of the, so I didn't know how to make a breakout room just for today. So I was going to do it on the fly, breakout rooms, assign 5, assign automatically. Okay, so you guys should just be thrown, hopefully, into one of 5 breakout rooms. And then look at your either intravenous, intramuscular, subcutaneous, intradermal, or intrathecal. Room 5, you might end up not having much to look up, but just see if there's another drug that's given in the spinal cord or in the spinal fluid, and then come back and have one person share what drug you found, okay?
Hey, Leslie,
Yeah.
for number 5, you technically, like, for the spinal cord, could you go like opposite, not infecting something, but like taking something out would be like stem cells or bone marrow or
Oh,
things like
you can just share whatever you guys found. If you found something that is like,
Oh, I wasn't even in that room, but I was just trying to think to myself, like, what's something else besides an epidural that would be like,
right.
it's not technically a drug, but why would you
Mhm.
stick a needle in a spinal cord kind of thing?
Right. Oh yeah, no, that's true.
Spinal fluid or things like that. So
Yeah, reasons to be poking into the spinal fluid area. Yeah, because I'm
Yeah.
not sure if anything. So let's see. So I don't know if I gave you guys too much time or not enough time. Hopefully, and I was thinking it would have been nice maybe to put you into smaller groups too and had everyone come up with, maybe 2 for each one. But so let's go to whoever was in breakout room 1 for the intravenous drug. What did you guys come up with?
So we found that a lot of things, almost anything, can be given through IV. Most commonly pain medications, antibiotics, things like that. So we were going to say antibiotics because that is maybe more relevant to our field, because if someone has a really bad abscess or infection, we might have to refer them to the ER to get an antibiotic through IV, because it will work quicker than if we were to prescribe amoxicillin or something like that.
And that's kind of one of the main reasons that intravenous drugs are so desirable, is because they can get the drug in there like fast and predictably, and it's it doesn't have to get absorbed through the stomach or in small intestine. It's just like in the bloodstream ready to go. So you can really control the dosage and the speed of getting the effective therapeutic outcome. So good. Okay, what about room 2, intramuscular?
It said like you could do like antibiotics and like hormones, and then like biological, like any vaccine that they usually do. And we talked about one like specifically tetanus was one specific one, but it was basically anything.
Yeah, that's true. And this is like TMI for sure. But I had, when I was pregnant with Lola, I had to go in and have a progesterone hormone shot in the butt, right in my gluteus maximus every week for 30, starting like week 10 until I gave birth. So I know what hormone injections are all about. And I've had an antibiotic in the glutes as well. So those are 2 very common drugs to go intramuscularly. So good job. Subcutaneous.
So we found insulin, morphine, epinephrine, things like that. So if you think, when somebody's giving themselves an insulin shot and they kind of pinch their belly fat and put it in there.
Mm-hmm.
So things like
and that's really interesting, right? Because to know that insulin is not given as deep. It's not as deep of an self-injection as intramuscular. It's a little bit more shallow. And then so I thought, oh shoot, I don't want to say it out loud because I have to double check. Because I think it was I don't know if it was in this chapter or not, but I thought that our local anesthetic was sub-Q in the mouth. Because we're not going for muscles.
It possibly could be. We just searched like subcutaneous injections, and that was kind of like the list.
Yeah.
We got, and we just like picked the most
common.
Yeah, common, or like that everyone would kind of understand or has at least heard the word.
Yep. Good job. And then what about intradermal? So just below the surface there, real shallow.
Yeah, so all the vaccines, they go intradermally, but they said like influenza and rabies vaccines, they're widely used intradermally.
And the rabies vaccine?
Yeah, and influenza.
Very good. Okay, cool. And then what about intrathecal? Did anyone get anything besides the anesthetic there?
Yeah, we found a couple there's one besides like for like pain medication, baclofen, which is used for muscle spasms, and then also Trey mentioned that chemo as well, it can be used.
Wow. Very interesting. Cool. Okay. Well, thank you guys. Good job. I hope that, I was like kind of stressing over that. I was like, either it's going to be a huge failure, but it seemed like it worked out pretty good. All right, so drug administration. So then the last one is topical routes, and a topical administration is, the point is to get the medication kind of right where you want it. So our topical anesthetic that we use, benzocaine or Orachix, the ones that you'll learn about over the summer for topical anesthesia in clinic, that is a topical administration. And then topical can be like localized, or it can actually end up being a systemic, something that's used systemically. So inhalation is one route, and that could be like local for like the insides of the nasal cavity, but it can also be something that ends up going more systemic and causing a systemic effect. Ophthalmic is eye drops or irrigation ointment, little medicated discs that they have as well. Otic would be the ear drops or ear irrigation. Transdermal is your, like your nicotine patch or your morphine patch or a hormone patch. So it's something that goes right on the skin and gets absorbed through the epidermis. Okay. So now we get into a little bit of the, we're at, oh my gosh, 10 minutes. We are not going to get even all the way through pharmacokinetics. So somebody watch the time and just blurt out time, because I'm trying, but so we're going to talk about 5 major kind of divisions of pharmacology, and we're going to get into each one. It's pharmacokinetics, pharmacodynamics, pharmacogenetics, and pharmacotherapeutics and toxicology. And I'm just going to do an overview of the general definition, and then we'll get into each one more and more. So pharmacokinetics, think of kinetics, think of movement. Think of movement. So think about how a drug moves through your body. So it's the way the body affects the drug, but and then it's broken down into 4 things: absorption, distribution, metabolism, and excretion. And all those things, do you see why I say movement? Because it's like it moves, it absorbs into your body, it's distributed through your body metabolizes it and changes the drug, and then you excrete it. So it's like you can constantly think of the drug moving through the body, doing all these different things and affecting the body, but kinetics is movement. So that's pharmacokinetics. Pharmacodynamics is the way drugs work in the living organism. So how they actually work, like what makes a drug work. So this includes drug mechanism of action, the receptor interactions, the dose response relationship, and the therapeutic and toxic reactions. And then genetics, pharmacogenetics deals with the genetic factors that influence an organism's response to a drug. So sometimes somebody's genetics might create a scenario where they respond completely out of left field from anything that they would have anticipated. So it's they study that. Pharmacotherapeutics is the part of science that actually studies all the good stuff that we want the drug to do. The prevention, the diagnosis, and the treatment of disease. So all the stuff, the positive stuff, we want the drug to be therapeutically effective. And then toxicology is the opposite of that, all the kind of bad things that can happen. So the study of poisons, chemical pollutants, and any undesirable effect of a drug on living cells, tissues, and organisms. So pharmacokinetics, so think of these 4 main areas is what we're going to talk about specifically. So it's the study of how drug enters your body, how it circulates within the body, how that drug moves around, how it reaches its target organ. When you have a headache or you have a sprained ankle, how that drug moves around the body and then relieves your headache, how that drug moves around your body and then relieves your sprained ankle or whatever. And then how it leaves your body once you've used it all up, or so that you don't have this toxic buildup of, if you keep taking pills, you gotta lose the old and start with the fresh. So it's about metabolizing the drug and excreting it. So those are the 4 areas. And I'm going to watch the video. This is going to take us probably pretty close to the end here, but let's watch this video as kind of an intro of what happens when you swallow a pill. Hold on, I'm going to have to. You guys see it?
Leslie, I think you have to share your sound if there's sound on there.
Say that again. I have to share my sound.
Yeah, like when you go to click screen share, it will be like share like video, audio or something, and you have to click that box.
Okay. Share computer sound. You guys are so smart. Okay.
Throat can help treat a headache, a sore back, or a throbbing sprained ankle. But how does it get where it needs to go in the first place? The answer is that it hitches a ride in your circulatory bloodstream, cycling through your body in a race to do its job before it's snared by organs and molecules designed to neutralize and expel foreign substances. This process starts in your digestive system. Say you swallow an ibuprofen tablet for a sore ankle. Within minutes, the tablet starts disintegrating in the acidic fluids of your stomach. The dissolved ibuprofen travels into the small intestine and then across the intestinal wall into a network of blood vessels. These blood vessels feed into a vein, which carries the blood and anything in it to the liver. The next step is to make it through the liver. As the blood and the drug molecules in it travel through liver blood vessels, enzymes attempt to react with the ibuprofen molecules to neutralize them. The damaged ibuprofen molecules, called metabolites, may no longer be effective as painkillers. At this stage, most of the ibuprofen makes it through the liver unscathed. It continues its journey out of the liver, through veins, into the body's circulatory system. Half an hour after you swallow the pill, some of the dose has already made it into the circulatory bloodstream. This blood loop travels through every limb and organ, including the heart, brain, kidneys, and back through the liver. When ibuprofen molecules encounter a location where the body's pain response is in full swing, they bind to specific target molecules that are part of that reaction. Painkillers like ibuprofen block the production of compounds that help the body transmit pain signals. As more drug molecules accumulate, the pain-canceling effect increases, reaching a maximum within about 1 or 2 hours. Then the body starts efficiently eliminating ibuprofen, with the blood dose decreasing by half every 2 hours on average. When the ibuprofen molecules detach from their targets, the systemic bloodstream carries them away again. Back in the liver, another small fraction of the total amount of the drug gets transformed into metabolites, which are eventually filtered out by the kidneys in the urine. The loop from liver to body to kidneys continues at a rate of about 1 blood cycle per minute, with a little more of the drug neutralized and filtered out in each cycle. These basic steps are the same for any drug that you take orally, but the speed of the process and the amount of medicine that makes it into your bloodstream varies based on drug, person, and how it gets into the body. The dosing instructions on medicine labels can help, but they're averages based on a sample population that doesn't represent every consumer. And getting the dose right is important. If it's too low, the medicine won't do its job. If it's too high, the drug and its metabolites can be toxic. That's true of any drug. One of the hardest groups of patients to get the right dosage for are children. That's because how they process medicine changes quickly, as do their bodies. For instance, the level of liver enzymes that neutralize medication highly fluctuates during infancy and childhood. And that's just one of many complicating factors. Genetics, age, diet, disease, and even pregnancy influence the body's efficiency of processing medicine. Someday, routine DNA tests may be able to dial in the precise dose of medicine personalized to your liver efficiency and other factors. But in the meantime, your best bet is reading the label or consulting your doctor or pharmacist and taking the recommended amounts with the recommended.
Okay, I am going to close with that and just show you guys briefly. Next week, we're gonna start where we left off with the next slide after that. We'll keep going, finish this slide, that slide deck out, but we'll start with the quiz, and then we'll finish this PowerPoint and we'll go on to the autonomic nervous system. So be familiar with that and have kind of looked that over, and then have your study notes filled out for this study note packet and for the autonomic. Okay, you guys have any questions at all?
So Leslie, for the quiz, is it until like where we got now? Like that's in that we need to study?
Just by next week, you would have wanted to have read all of chapter 1 and chapter 2. So the quiz questions will only be probably the first part of chapter 1 or the first part of the PowerPoint slide, you know, that information. But regardless, you would have wanted to have studied chapters 1 and 2 by next week anyways. So you guys will be fine. I mean, as long as you're reading the material that's assigned that week and keeping up on it, making your notes and going through your study guide, you'll be fine. But it's pretty much just on the first part, because I kind of, as I wrote the questions, I kind of guesstimated how far into the PowerPoint I would get. And so I didn't go to, I don't know that I did not go into pharmaco dynamics at all.
Is that including the syllabus?
But yeah, so basically like what we talked about in the beginning, so some of the major things that you would want to have taken away that you'd want to know for this whole semester, not some obscure thing on the syllabus, like, you know, but some basically like what we hit on the PowerPoint. Okay. Take care, have a little break before you guys have your next class. I'll see you, half of you I'll see you on Thursday with Kristen.